GAD65, glycine receptor, and or amphiphysin autoantibodies in the blood and or cerebral spinal fluid. Diagnosis is often made off of clinical presentation, symptoms, EMG, and the antibodies. And then the average time to an accurate SPS diagnosis is approximately 7 years. Now the good news is, based on the patients and their families that I've been speaking to in the last, I would say, 1 to 2 years, a lot of these people are starting to get diagnoses within months. If I had gotten a diagnosis that early, I would not be in a wheelchair. So, treatments. The first line is, and I've done all of these, so if you have any questions about them, I've literally done pretty much all of them. First line, IV steroids, IVIG, or subcutaneous immunoglobulin, muscle relaxers like baclofen, and the staple, and one of the ways that you actually know if a person has SPS is if they can tolerate extreme doses of benzodiazepines without ever being exposed to the medication. We're finding that some of these patients can tolerate hundreds of milligrams a day, but they've never had the medication in their life. Second line treatments include plasma exchange, which I like to describe as being dialysis for the immune system. It takes out the antibodies, all the antibodies, good and bad, and replaces it with albumin or protein, or in some cases, human plasma. Many people take oral immunosuppressants, known as Celsep or Imurin, or biologics / chemotherapy agents like rituximab, or most people, a combination of these therapies. Third line treatments include cyclophosphamide, which is a cytotoxic chemotherapy agent, and a combination of therapies. Most people with the disease are on a combination of therapies. Fourth line treatments are extremely experimental at this point. The FDA has not approved stem cell therapy or transplant for the treatment of SPS. There have been some clinical trials, and they've shown tremendous promise within the first 1 to 2 years. However, for some reason, these patients are not making it to the 5-year mark. We don't know why that is yet. So, physical activity, why you're all here today. The importance of physical activity, as I like to say, use it or lose it. I've lost my ankles. So my goal is to keep moving my knees, my hips, and everything upstream so that I don't lose it permanently. Now, as a type 1 diabetic, my blood sugar control is extraordinarily better, and I require so much more, or so much less daily insulin when I exercise. Type 1 diabetes and SPS are both GAD65, one of the antibodies, mediated diseases. So what you will often see is that type 1 diabetics, or individuals with type 1 diabetes individuals with SPS have or will develop type 1 diabetes in their lifetime. Up to 60%, I believe the research says. So, exercise, it does amazing things for the biochemistry in the brain. It causes, SPS naturally causes a deficiency in the neurotransmitter GABA. But physical activity naturally lowers my stress and anxiety levels. So without even having to mess with medications on a daily basis, I don't have enough GABA. But if I just go and exercise, that makes up for what I'm missing in my brain. Chronic muscle spasms. It's a part of SPS. It's the most common part of SPS. Exercise can be painful, but my policy is 30 minutes, and if it's really that bad in 30 minutes, you can go home. But try it for 30 minutes. What I typically find is that I'm leaving the gym several hours later because it makes me feel so good. Additionally, being in a chair, it's challenging being on continuous tube feeds, which I normally am when I'm not dressed in uniform, and using a wheelchair. Not being able to use your legs, not being able to use your core in the same way that everybody else does when they ambulate. It is harder to maintain a healthy weight. So this is how I make up for it. I go to the gym every day. So why Taekwondo? So I started back to Taekwondo after I found out, hey, you're not going to be able to play varsity basketball anymore. Something needed to replace that for me. So I went back to the American Taekwondo Association, and they are a wonderful organization, and they have a very unique program in that they've developed an entire wheelchair curriculum from white belt to, I don't even know what level of black belt, definitely up to third degree black belt. But because I do have the use of parts of my legs, my instructors have thrown the wheelchair curriculum out the window. They've said, okay, she's special, that she doesn't need this, she's so special that she doesn't need the special curriculum. And we are doing traditional martial arts. So we focus more on the angle of my chair, where I'm looking. If my attacker is coming from this way, and I'm looking this way, and my techniques are going this way, I'm gonna miss my attacker, who's coming in at close range on me right here. Kind of defeats the purpose of self-defense. And then we always try to focus on developing strong technique without worrying about things like stances, because I cannot control my ankles and my feet. So it's kind of pointless to focus on that. So rather than focusing on how my foot needs to be turned out this way, we focus on, okay, knee's going this way, we're gonna bring it up, we're gonna snap it out, we're gonna bring it back in, and we're gonna set it down. A solid front kick, but we're not gonna worry about how my foot is turned, because we can't control that. Limitations with my feet and ankles. They do hurt my score in competition. That's the kind of unfortunate part. But I do get judged to the same standard that everybody else does. So when I place second, I've placed second because that's how I performed that day against my standing peers. If I placed fifth, that's how I placed against my standing peers. And then ultimately, in a self-defense situation where my life is on the line, technique goes out the window, and you're doing whatever you have to fight back and fight hard against your attacker. We don't ever want to have to use our martial arts skills, but they're there if we need them. So, my favorite parts of martial arts. Teaching. I love helping to train up the next generation of black belt leaders and showing them how much further they can go. So many people will come up to me and be like, Miss Bear, I would love to be a world champion like you someday, but I don't think that I can get to the state champ level. Well, that's kind of the first step, is to getting the state champion title. We don't get there overnight. It takes years and years and years of practice. So, that brings me to my next point. Judging at major tournaments. The ATA has just wrapped up their Spring Nationals in Dallas, Texas. The most elite of martial artists train for years to be the very best at state, district, and world championship levels year in and year out. And one of the coolest ways to serve in the sport is by judging your juniors in rank, which is what the patches on my sleeve allow me to do. You can learn a lot from anybody, and I mean anybody, if you're willing. And of course, competing. I will never get over the adrenaline rush of being called on deck, being told that I'm going to be next, and just pumping myself up, getting ready to go. It doesn't matter if it's a local tournament. It doesn't matter if the state title is on the line. It doesn't matter if the district title is on the line. In fact, it doesn't even matter if the world title is on the line. I love just getting pumped up and seeing my hard work and my discipline pay off. It challenges me to be better than I ever thought possible. And that's probably the coolest thing. Now in martial arts, there's a big piece that we stink at as Americans, myself included. And that is the instant gratification piece. Martial arts has a big part of delayed gratification. You work out for months, and you do the same drills, hundreds and hundreds and hundreds of times over the years until you get it down.
So they're telling me it's too loud. I'm sorry. No.
So you get it down, and then you keep doing it some more. You do not always pass your testings and your midterms. I'll never forget, I was testing for my brown belt, decided, I believe it was, and I could not break my second board that I needed to break for the testing. And I was devastated. But what I did is I went back to my dorm room and I hung up my brown belt recommended certificate, and I looked at that thing until I passed my testing for brown belt decided. I saw that thing every single day in my dorm room until I passed my test for brown belt decided. However, you do gain valuable life skills, and this is what I really want to focus on. Self-control, discipline, integrity, determination, goal setting, how to work with people, different personalities, that's an art. How to win and lose with grace and respect. Now, I've have been in this sport, gosh, it's surreal looking at this number, 2007. I did take a little bit of time off when I was in high school, but I have been in this sport for the better part of 10, 11 years at this point. And that is many, many, many private training sessions, hundreds of classes, hours and hours and hours at tournaments, at the local, district, and world championship level, personal time working out, staying in shape, and years of patience with myself and with the students that I've taught. Now, the most practical application of this sport is the self-awareness that I've learned can and actually has already kept me out of potentially dangerous situations. In college, I was being followed by someone that appeared to be out of place. As a female and as a wheelchair user, trying to go back to my car in the garage, it just didn't seem right that this individual was taking a course across campus that if you knew the campus made no sense at 9:30 at night. I don't know what this individual's intentions were, but I do know that he was crossing the street every time I was crossing the street. And then what I was doing made no sense. And he was following me. So I backtracked to the student union, did a bunch more things that did not make any sense, and eventually shook this person off. But had I not been trained in self-awareness, in the martial arts, who knows how that could have ended? Because my car that night was on the bottom floor of the garage, which is at least 40 to 60 feet underground. You can scream at the top of your lungs and no one is going to hear you. And so when I just want to give up and turn in an assignment, as so many grad students want to do when they're tired, and it's nearly the next academic break, I remember why I started. I buckled down, disciplined myself, and finished strong. These are my references. And I'll turn it over to